Hey guys, Dr. Andy here. Today I want to tell you about something called inflammatory pain. Inflammatory pain is the other more common type of pain that we see here in the office. And this is pain that's more traumatic in origin. So the other type of pain that we typically see is something called ischemic type pain, which is gradual, meaning it came on slowly over days, weeks, months, even years, right? But with inflammatory pain, we typically have a traumatic event. And you can really pinpoint, I didn't hurt this time. This event happened, think car accident or a major slip or fall, right? And now I'm in pain, okay? So we start off with inflammatory pain, meaning there's a lot of inflammation that is driving your pain levels, all right? And it's coming from some kind of a traumatic event. And typically it's within the last 3 weeks. After you go out past that 3-week mark, it moves a little bit away from the inflammation and a little bit more towards ischemia, which is it's no longer inflammation driving the pain. It's now a loss of blood flow, okay? But if it's within the last 3 weeks, it absolutely qualifies as inflammatory type pain if we have some kind of traumatic event. And this really matters because it drives how we treat you and what is the best course of action for you as the patient, okay? Typically, the pain is sharp and it is constant. It is not going up and down. It can be sharp, it can be throbbing, sometimes it can be kind of burning, and it is definitely constant. It doesn't have this kind of like ebb and flow too much to it while it's hurting, okay? Now it does have a little bit of an ebb and flow during the course of the day. And what I mean by that is typically when you first wake up in the morning, it hurts a lot, right? So you follow a pattern of worse, better, worse through 24 hours. Okay? So first thing in the morning, it's worse. It hurts. And then during the course of the day, it actually feels better as you're moving around a little bit and maybe, you're keeping your mind off of it, okay? But then in the evening, it hurts again. Okay, so with ischemic type pain, it feels better in the morning and then gradually gets worse throughout the day. This is worse, better, worse. Okay? What do we do for that? What is the best course of action? What can you do to feel better? Especially if this pain is kind of more recent. You really need to kind of heads up to this line down here that I'm going to get to in just a moment, okay? So what can we do to make you feel better? Absolutely, chiropractic adjustments can help your pain if you have inflammatory pain. It's one of the most successful things that we can do, okay? So we can get you in here, we can provide some spinal manipulation, some chiropractic adjustments, and you will start to feel better, usually immediately, okay? The other big part of it is education with exercise, okay? So with ischemic type pain, it's go move, you're gonna feel great, it will help you, okay? With a inflammatory type injury, it's really important so that you don't make it worse to use pain as your guide. So that's the education aspect that we use with exercise, okay? Meaning if you feel pain while you are exercising, then you need to back off a little bit. With ischemic type pain, work through that pain. It will make you better. All right, typically, all right. With with inflammatory type pain, you want to butt up against that pain level. If it feels like your exercise is making your pain worse, back off. Don't push through that pain because you have so much inflammation, it can in fact make it worse, okay? So that's the educational piece that we use with our exercise, and we can also use something called an activity tool, right? So we can kind of determine where is that level of pain, and then, be able to kind of increase your intensity, maybe 10% each day, as long as you feel comfortable, okay? So if you have had an injury in the last couple of weeks, right, and it's traumatic in origin, all right, and your pain is sharp and it's constant, and it's bad in the morning, gets better through the day, and then bad again in nighttime, be careful with how you move your body so you don't make it worse. And absolutely what we can do to help is chiropractic adjustments, and then use some of the exercises that we do here in the office to keep you midline, stabilize that problem area, and get you feeling a whole lot better, right? If you have any questions, send them our way. Always remember to live with passion and not pain.